Here is a statistic that should stop every man over 40 right now. A large-scale study published in the Journal of Clinical Endocrinology found that over 40% of men over 45 have at least one serious hormonal or metabolic abnormality, and their standard annual blood panel showed nothing wrong. Think about it. You walk out of the doctor's office with a complete clean bill of health while your body is silently building towards a hormonal crash, metabolic breakdown, and your first cardiac event. This is not fear mongering, this is biochemistry. Hello, I'm Dr. Ngundi, a medical doctor and a fitness enthusiast. And today I'm going to show you the 3 blood tests every man over 40 should be demanding from his doctor, tests that most hospitals skip entirely. These 3 tests detect hormonal decline, metabolic disease, and cardiovascular risk years before you feel a single symptom. Write this down, bring them to your next appointment. Your biology is running right now, whether you are watching it or not. Blood test number 1, and here is what is critical, and it's not just testosterone. It is the full testosterone panel, and we are talking about total testosterone, free testosterone, and SHBG all together. Most men are told your total testosterone is normal, you are fine, while the biology says otherwise. Think of it this way. Your total testosterone is like the number of cars parked in the city, and your free testosterone is the number of cars annually moving on the road. You can have a city full of parked car and still have complete traffic stand still. After 40, a protein called sex hormone binding globulin or SHBG increases significantly. It binds to testosterone and locks it away from your tissues. So even if your total testosterone reads a normal 450 nanogram per deciliter, your free testosterone, the hormone that actually acts on your muscles, your brain, and your cardiovascular system, can be critically low. And here is a number you need to see. Total testosterone should be above 600 nanogram per deciliter, while your free testosterone should be above 15 picogram per milliliter. Anything below that, and your body is operating at a biological deficit. Men with low free testosterone don't just lose muscle, they experience increased visceral fat, brain fog, depression, and measurable loss of cardiovascular protection. This is not an opinion, it is endocrinology. Now, here is what I want you to know. At your next checkup, ask your doctor especially, can I have a total testosterone, free testosterone, and SHBG tested together? All 3, not one without the others. If this is already changing how you see your annual blood work, drop the word panel in the comment below. It tells me you are committed to understanding what your body is actually doing. Now, let's move to the second blood test. HbA1c. Here is the simplest way to understand it. Your blood sugar is the weather today. HbA1c is the climate of the last 3 months. It measures the percentage of your red blood cells coated by sugar, which is the process called glycation. And here is why every man over 40 needs this number. Insulin resistance, where your cells gradually stop responding to insulin, begins silently, often a full decade before a diabetes diagnosis appears. During those silent years, elevated blood sugar is quietly damaging your blood vessels, your kidneys, your nerves, and your brain. This is not an opinion, it's nephrology, neurology, and even cardiovascular medicine all pointed to the same conclusion. Here are your numbers. Below 5.7, that's normal. But move to 5.7 to 6.4, that is now pre-diabetes. This is the danger zone. Most men here feel absolutely nothing. And above 6.7%, that is already diabetes. But here is what most doctors miss. Even at 5.5%, technically it is the normal range. If your HbA1c has been rising years over year, that trend is a biological warning signal. The trajectory matters as much as the number itself. And the good news, insulin resistance is almost entirely reversible through resistance training, targeted nutrition, and sleep optimization without medication. Here is your medical directive. Ask for HbA1c at every annual physical checkup. If your result is above 5.5%, ask your doctor to also run a fasting insulin test. Those two together give you the full metabolic picture. Now, stay with me because blood test number 3 is the one most cardiologists now agree is more predictive of heart attack risk than your standard cholesterol panel, and most men over 40 have never heard of it. Blood test number 3 is ApoB, or apolipoprotein B. Your standard cholesterol panel gives you an LDL number, and for decades, LDL was the gold standard for heart disease risk. But here is the fundamental problem. LDL measures the cholesterol contained inside the particles. It does not count how many particles are in your blood. And it is the number of particles, not the cholesterol inside them, that determines how many times your arteries walls are damaged every single day. Here is the analogy. LDL is like measuring the weight of cars on the highway, and ApoB counts the number of cars. Even if each car is small and light, the highway with 10,000 cars can cause far more damages than the highway with only 500 cars. APO counts every single atherogenic particle, LDL, VLDL, and remnant lipoproteins. It is the most direct measure of the true cardiovascular risk available through a standard blood draw. Now, here are your targets. You should be below 90 mg per deciliter for standard risk, or below 70 if you have a cardiovascular risk factor, and below 60 if you have had a cardiac event or you have diabetes. A man can have a normal LDL of 110 and still have an APO of 130, meaning his arteries are under relentless particle bombardment that his cholesterol test is completely blind to. ApoB is not a special test. It is inexpensive, available at virtually every laboratory, and covered by most insurance plans. It is simply the most underutilized cardiovascular marker in men's preventive medicine. Your medical directive is that at your next appointment, say exactly this. Can we add ApoB to my cholesterol panel? Write it on a piece of paper and hand it to your doctor if you need to. So here is your protocol. 3 tests, 1 appointment. Number 1, ask for a full testosterone panel, total testosterone, free testosterone, and SHBG. Number 2, HbA1c. If it is above 5.5%, add fasting insulin. Number 3, ApoB, alongside your standard cholesterol panel. Print this list or write it down, bring it to your doctor. Do not wait for the symptoms. By the time the symptoms appear, the biology has already been running in the wrong direction for years. These 3 tests give you a complete window into your hormonal system, your metabolic system, and your cardiovascular system, the 3 pillars that determine how you age after 40. So, if this video shifted how you think about your annual blood work, write the word panel in the comment below. It tells me you are committed to aging on your own terms. And if you've already had any of these tests done and want to understand what their number means, tell me in the comments. I read every single one of them. And if you're a man over 40 and you have been wondering what could happen if you stop exercising for 2 weeks, or if you are the kind of man that does not exercise at all, you might be interested in watching this next video, where I explain in depth what could happen in case you stop exercising only for 2 weeks, or the changes that could happen to your entire body. And if you're not subscribed yet, this is exactly the kind of information you will want to keep receiving. Hit the subscribe button so you don't miss the next video, which will be coming on Thursday. Stay smart, live long, and I will see you in the next video. And remember, age on your own terms.